were Presidents Bill Clinton and George W. Bush's largest impacts on the program?
Well, Bill Clinton had a huge impact on the program, which I outline in my book. I deal with in detail in the book. Prior to the coming of Clinton administration, took office in 1993, the federal government had imposed certain Medicaid mandates on the states, and many states felt that they did not have enough discretion to do innovative things. And there is a way a presidential administration can act to give states discretion, and it's through a policy tool called a waiver, which is embedded in statutory authority for the executive branch. And it basically is an opportunity for the executive branch of the federal government to say to the states, time out, we're going to let you do things in your state that you couldn't do under your regular Medicaid program, the regular statute that governs Medicaid. And where Clinton had a huge impact was in changing the federal government's willingness to give these waivers, to let states propose and come in with innovative ideas. Up to Clinton's time, the federal government, primarily for budgetary reasons, had been very restrictive in terms of whether it would respond to state requests for waivers. And under Clinton, he said, come one, come all. There were obviously some guidelines states had to meet, but he was much more welcoming of waivers, and states put in all sorts of waiver requests, both for to deinstitutionalize people who've been in nursing homes and large public institutions, and to do innovative things more generally in their programs. So many states, for instance, took these opportunities that waivers provided to expand eligibility to new categories of people and to put them in managed care organizations that were out there. So there was this very serious empowerment of the states then under Clinton, and President Bush pretty much followed suit. He had some unique themes and twists that I get into in the book, but states also were given waivers quite handily under him, and one of the major waivers, which figures prominently in the current election year debate, is that the Bush administration gave Governor Romney, then Governor Romney in Massachusetts, a waiver that became the platform for what many of us now call Romney Care, this sort of universal health system that Governor Romney and the state legislature there approved. And I think it's important to remember, it's never much reported, that whole system rests on the willingness of the federal government to give the Medicaid program there a waiver. So it's very much a partnership. It's not just a state-only kind of proposition. So I think there were certainly other themes during this time. I would say with respect to Clinton, that when Newt Gingrich tried to impose a block grant, this was in 1995, on Medicaid, that President Clinton vetoed that initiative. The imposition of a block grant would cut funding from Medicaid, and it would have been extremely unlikely that it could have grown at the pace it did if Representative Gingrich had succeeded in that. And Mr. Clinton vetoed that, so certainly left his mark on the program in that way too. There were a lot of other statutory changes, but more of an incremental nature, and I think those capture the key developments.
With regard to the recent healthcare reforms, how have those affected Medicaid?
It's had a huge impact on Medicaid and been a big surprise in some senses. As you recall, in response to an earlier question, I said that going back historically, those who favored a universal health system for this country never imagined that Medicaid would play a very big role in it. And in point of fact, with the Romney plan, Romney Care in Massachusetts sort of serving as the state-based laboratory, we had the emergence of what the president now embraces as Obamacare. And Medicaid plays a huge role in that reform. Of the 32 million people in 2010 that were slated to gain coverage, half of them, about 16 million, were expected to be added to the Medicaid rolls. Everyone under 133% of the poverty line would become eligible for Medicaid. Those above that would get federal subsidies, at least below 400% of poverty, to be in these health insurance exchanges. So Medicaid play a huge role. That role diminished some in health reform in the wake of the recent Supreme Court ruling that essentially ruled that whether states wanted to expand coverage to these new groups was a decision they could make, that they would not be penalized, have the regular Medicaid programs penalized if they weren't. And some governors have said they do not wish to participate. But my bet is over time that because the financial incentives are just very great for the states, that most states will come on board and participate in this Medicaid expansion. And I think the most recent Congressional Budget Office estimated that even over the relatively short term, 11 million more Medicaid enrollees would be signed up in the wake of the Affordable Care Act. So it had a huge impact on Medicaid.